In some patients we use gastric balloon, but gastric balloon is not effective as surgical procedures. But if a patient have no indication for surgery, at that time we can use balloon, for example, on BMI under 30. And patients with BMI between 30 and 35, no any obesity-related disease like diabetes or etc., we can use balloon in these patients. With balloon, patient can lose 15 or 20 kilogram of their weights, and we can remove balloon after 6 months or 12 months. There is two types of balloon. We can use gastric balloon in some overweight patients, but there is no border for balloon indication for overweights. But we choose the patients under BMI 30 or the patients with BMI 30 and 35 and no obesity-related diseases like diabetes, hypertension, etc. And we can use balloon for these patients, but we can't treat these related complications and morbidities. There are two types of balloon. One used for 6 months and the other for 12 months. We prefer the balloon that can use 6 months, and if the patient need, we will use a new balloon for another 6 months.
What is the difference between 6 months and 12 months? Why are you not recommending the 12 months balloon?
With balloon, we can see some complications. Balloon is very safe procedure for overweight patient, not effective as surgery. But if the balloon, we use balloon until 12 months, we can see some symptoms, some complications, and it's this period not effective, more effective regarding the period, not parallel to period. So we use the short period balloon.
6 months balloons, how many kilograms they lose with 6 months balloon?
With this balloon, the patient can lose 10 or 50 kilograms. And this is more comfortable and useful for patients if they are not morbidly obese.
How long the duration of the procedures for gastric balloon?
Approximately 15 minutes.
And they will stay in hospital one night?
But there is an
no?
endoscopy procedure too.
They will stay in hospital one night?
No, they won't stay in hospital, but one day we need to follow in the city the patients for going to their countries.
How long they should stay in Turkey for that procedure?
One day enough for us. After the post-procedure day, we will have a contact with patient, we will examine the patient.
But they can return home?
And then they can return home after the other day. Yes, they can return home at this day.